Hello everybody. We are going to start our live session soon with Hi all, so this is Dr. Ankita. All of you all know me. I'm Hemali. So Ankita is an airway focused dentist and the only Indian ambassador of the Breathe Institute, and she has been directly trained under Dr. Sarosh Jagi. And y'all have followed my post up until now with respect to obstructed airway and how nose breathing helps. We are going to talk and elaborate a little bit more about that. That's why we have a specialist amongst us who's going to help us out. So, Dr. Ankita, tell us, how was your day? How are you doing?
Thank you. I think it's a beautiful Sunday morning. We all are home, locked down. Yeah, but thank you so
Nothing
much
to do.
for the lovely introduction. And Dr. Hemali, I'm so glad to be working with you. She is someone who is always willing to learn and she's exploring new things. And as I introduced this concept of airway to her, we've been exploring so much into this field that I just feel that it's so important that we all keep on learning, Dr. Himali.
That is so true. So, I have been actually in fascia
Right.
since 2014. So it's more than half a decade. So almost 6 years that I've been working with fascia. And I did already know about this. I did also a short course in 2014 on the TMJ.
Right.
But I really never, I had it in the back of my mind, but I never gave it importance as such. And a
Right.
lot of physios do that because out of the 100 patients that we see, hardly 1% of us see PMJ patients.
Right.
Like 1% of patient population that we are treating is TMJ. Most of them are other bodily issues. So this is going to be a good talk about how we can actually collaborate because over the past 1.5 year about reading and working with you has made me realize that collaboration of the TMJ with your entire body posture is also very important. So
Right.
actually, I wanted to ask you a question first to begin with. So so obviously all the dentists are very closely associated with the TMJ, right? But how did you end up getting into like airway and airway obstruction
Right.
and like working specifically with TMJ and oral issues?
Right. So, Himali, it's very interesting that though we are dentists and we are associated with the TMJ, a lot of dentists also don't know about it. And it may surprise you that it is almost 50 to 60% of our population is actually suffering from TMJ airway issues. It's because we don't know the signs of it, we are unable to explore it. So many patients that you and me get, they actually have these signs already. And if we learn
Okay.
to diagnose these signs, we will be able to help them with the physiotherapy, with the dental side. So many things collaborated together in a much better way and much sustainable results. They will not need continuous things then again,
That
and
is
the way I entered into airway was I'm a pediatric dentist per se. But
yeah.
when I learned that, some muscle dysfunctions were causing some kind of jaw damage, there was a change in jaw position because of the muscles, the way they act. I was quite surprised. I was like, how is this possible? So much of bone structure is changing because of the jaw, because of the
Yeah.
muscles. But when I
Yeah,
like
correct.
went on to learn more about it, I digged into it. I did my research, I did my courses, and I realized that it's not just this. There's so much more to it because right behind your teeth is your airway, and this airway and the clenching and the TMJ, they all are so interlinked. That sleep pattern and everything that was influencing the entire posture of people, and that is when I
Okay.
realized that your fascia, which is right beneath your tongue, plays such an important role. And when I know that you were a fascial specialist, I was like, this is something which a physiotherapist plays a very important role over here. Like,
That's
even like if your
true.
jaw joint is affecting the entire posture of your
Yeah.
body, I was like, here's
Yeah.
where the physiotherapist also plays an important role.
No, that's amazing the way you've integrated all the services for yourself and for your patients and our patients now.
Right.
It's brilliant actually. So how about you tell us, like for physiotherapists who are not aware of this. So now I've already studied about it. But from your point of view, what are the two or three easiest signs that you could notice and figure out, okay, this person has something related to the airway or the TMJ, and then we go in depth and figure out about it.
Okay. I think the first thing you could probably ask your patients is, are they breathing through the mouth? First, instinctively, every patient will tell you, no, I'm not breathing through the mouth. Okay,
Yeah,
instinctively, every
correct.
person does that, right? Because you never observe so much of your breathing, right? So you
And more
ask them,
than observe, I think it's very ingrained into your head.
I
Okay,
lost your
Ankita,
voice
I
there,
think
Hemali.
yeah, there was a slight delay,
Yeah.
so I think we lost some part of it. You'll have to repeat what you said earlier.
So I said that, like mouth breathing, instinctively any patient is going to tell you, no, I don't mouth breathe. Okay. So you
Yeah,
ask them, are your lips parted through the day? Do you think your lips are open
yeah,
most of the time? Do you think you're sleeping with an open mouth? Again, with adults, we're
yeah.
so unaware about what they do
We lost your voice.
now.
Yeah, so I think Dr. Ankita, you'll have to go slightly slow. So in case if we miss something, I can just tell you. So you
Sure.
can start
Sure.
again.
So with adults now, most often, they're sleeping and they don't realize what they're doing in their sleep, right? So, if they are
Yeah,
parted with their lips or anything, so it's best to ask their partners or someone in the house that, are they sleeping with a parted lip posture? Are they snoring in their sleep? What are they really doing? There are ways to do some sleep studies and all, but this is, I think, which a little later stage. When you're just first
yeah,
introducing
correct.
it to a patient, I think it's best to ask them, whether they are just open mouth posture, snoring in their sleep. Another thing important, you can ask them, are they having a lot of jaw pain? Or are they having
Correct.
any clicking in their jaw? You can also check
Yeah,
on, they have constant forward neck and tensed muscles in the neck and shoulder. Headaches,
yeah,
migraines are pretty common. If they have any postural problems, back pain or anything. These are basic things I think from a
yeah.
physiotherapist end that you could ask them.
Yeah, so that is so frankly speaking, like having back pain or neck pain is pretty common anyways due to the kind of lifestyle that we live, which is the laptop lifestyle or the sitting lifestyle. So I
Right,
think what Dr. Ankita is trying to say for all the physios out there, like a discriminating factor here would be obviously breathing with the mouth that's open, which you would observe. And the other thing is the jaw pain that she talked about. A lot of people
right,
also do get headaches because of, uh, yeah, sorry, I lost you there for a second. So a lot of people also get headaches because of cervical placement. So we will talk about this later about how the posture affects everything in the
right,
jaw and how the jaw affects everything in the posture.
right. So,
So another,
Dr.
so
Himali, there was some interesting case that we can talk about over here. Uh,
yeah,
remember, we had this patient who came in. Now, this patient had typically like too much of headaches, migraines, lot of jaw pain.
yeah,
Uh, they had postural problems, constant backache, neck pain, shoulder pain, lot of tingling in the
correct,
feet, walking with pronated feet. And
yeah,
when we analyzed the patient, there was so much of airway, TMJ issues over here.
that's true,
And
correct,
I also saw like there was a tongue tie and how the whole fascial system was involved, and that's when the signs through the whole body were being seen. And the minute we started
yeah,
doing some therapies, the muscle, jaw correction, tongue tie releases, we saw that complete change in the patient,
we
how
change,
the posture
correct,
completely
correct.
changed. And when we integrated with physiotherapy, there was a dramatic change in this patient.
Correct. So I think what happened with that patient was obviously he was complaining of a lot of issue with the TMJ and had forward head and backache, which a lot of people have. So for us, what happens is sometimes if you're not aware that your backache, your knee pain, or even your shoulder pain could be coming from the jaw, you are easily going to discredit the jaw and the entire facial system, which a
Right,
lot of us do, right?
right, right,
We will treat the back. So
Right.
around 80% of the problems and issues get resolved with physiotherapy treatment of only the back, or only the neck, or only the
Right.
feet. And eventually, unless it's integrated with the entire body system, you see them relapsing.
Right.
Now, when a person relapses with respect to either headache, neck pain, or even knee pain, and you just cannot put a finger on what's going on, it's
Right.
best to go and check higher up, which is the jaw placement, whether they
Right.
are mouth breathers, whether in spite of correction they are going into a forward head position, or even
Right.
if they are in a correct position, are they still breathing through their mouth and not using their nose?
Right.
And like you said, snoring at night. Snoring is one of the biggest signs. A lot of people snore at night, and we are like, oh, he snores, make a joke about it, probably record few videos and forget about it, right?
Right.
But
And
anything that is, sorry, go ahead.
no, so interestingly, like with airway, what happens most of the time is because it's such a flexible tube, okay, you want to open it up whenever there's like a restriction to it. So
Yeah,
I've noticed most of these patients through the day, they will always try to come forward to open up that airway. And that's how they
correct.
start resulting. And it's an involuntary action, like it's not something that they're doing
Yeah,
it on purpose, but it's an involuntary action. Like even while sleeping, they'll go and end up sleeping with an extended neck. So it's very important to see how they sleep, and that's how also they're resulting in every morning when they wake up, they have like stiff neck, stiff shoulders,
correct.
all of this.
Correct. So a very good point here. So one thing to notice over here is that no matter what happens, the brain will first protect the breathing, even at the cost of posture and pain. It really doesn't care how your posture is or how much pain you are in. The only thing the brain knows as is survival. It's the survival instinct that's inherent in us throughout the evolutionary cycle, right? So
True.
your body will keep on compensating again and again by means of fascia, by means of nervous signals, by means of different kind of compensations to keep your airway open, no matter what, because
Right.
it wants you to survive. It doesn't care how you are surviving, what your quality of life is, or what your posture is. It will only think about survival. So physio is a very good point to note here. If your patient is just surviving and not living, you are supposed to come into picture and correct this one thing.
I agree.
Correct, Dr.
I agree.
Ankita?
But
You don't just
Himali, what
want
do
them
you
to
think
survive.
that on a physiotherapy note, how big
Yeah.
a role would you play into, this airway, TMJ, or all of this, the fascial system and all? Where do you play such an important role?
So basically, if you look at everything, if you look at the entire body, now physiotherapists have become very aware as to if there's a local problem, you still seek a global solution for it. So if you just have knee pain, physios don't just look at the knee, they look at the pelvic position, they look at the neck position sometimes, they also look at the diaphragmatic position. And I feel that that's extremely important. But now this one another part which you have to integrate is your jaw position also, because that is something that is not yet integrated. And people who understand the fascia will also understand that the tongue that you treat, or you do tongue tie releases, right? So the tongue is a part of the deep anterior facial line, which kind of stabilizes, not kind of, it stabilizes the body.
Yeah.
It literally makes you stand. It literally stabilizes everything for any kind of movement. So whether it's someone who's really young, or whether
Right.
it's someone who's really old, or someone into sports, because unless you have that inherent spinal stability, your pelvic and your diaphragm is not working in conjunction with each other, you're not going to be able to give optimal function. So I was reading about this, and most of the physios know that posture is something that you maintain, that your body tries to maintain with least amount of energy expenditure, at the same time being most productive and efficient in that movement,
Hmm.
right?
Correct.
So that's what we want. If you are in a forward head position and you're breathing through your mouth,
Hmm.
then, as you saw in the videos that I posted earlier, you will see that the air is not completely going in. You're breathing 50% through your nose and probably 25 through your mouth, right? And you don't want that discrepancy. So when you're trying to do anything that's regular work. So even like lifting, so a lot of people are traveling right now because it's locked down and they don't want to stay home. So they are going abroad or they are going somewhere in the interiors. You're packing bags and you're lifting bags, right? Now imagine while lifting that bag, your muscles require oxygen. That oxygen comes from your lungs and that the lungs take oxygen in through your nose, but for maximum people through their mouth now because of our lifestyle, right? When the oxygen or the air is being taken in through your nose, it is 100%. So our lungs have a tidal volume. That is a volume which the air goes in at any point in time. So 500 ml is the tidal volume. We breathe in 500, we exhale 500 ml. Now, if you're breathing through your nose, say with respect to efficiency, you are at 90%. So you're breathing in 400 ml, right? But if you're breathing through your mouth, you're breathing one fourth or half of it, which is very less. One fourth or half means you're decreasing the oxygen availability to your lungs. And a lot of people also breathe out through their mouth, right? They're like, and when they do this, they don't, the back pressure that is needed for the oxygen to get uh, absorbed in the alveoli is not present. If there's no
True.
back pressure of carbon dioxide, the oxygen absorption overall decreases.
True.
So it's not only just breathing through the nose, it's also breathing out of the nose, not breathing
Right.
through the
And
mouth.
interestingly, Hemali, they use a lot of their accessory muscles for breathing,
Correct.
and which
Correct.
is where your posture will get involved again.
Yeah. So when they start using the accessory muscles, which is your splenius and your SCM, you'll see like they're doing this all the time. The cervical fascia becomes tight, and I think Ankita, you'll be able to explain better about this. When the cervical fascia becomes tight, the hyoid bone moves. The position of the hyoid with respect to your cervical, that is your C012, changes. And as it changes, you suddenly, from, okay, let me put my hair away. Suddenly, from this position, you are here, right? Or you're extremely compensating. So either ways, I think
Right.
that doesn't work out well. And that's where I think
Right.
Dr. Ankita, your job comes in. You start educating patients. And now onwards, I think even the physios will start educating patients once they know more about this. So,
Yeah, I think it's so important, right? In the end, like
yeah,
everything is dependent on that one breath. If we are not breathing, there is nothing left in our body in the end. And interestingly, there are some important facts when we were talking so much about breathing that
correct.
we always consider that oxygen is important, but what about the carbon dioxide? We feel that carbon dioxide is the bad gas, but it's not
Yeah,
so. When If there isn't enough carbon dioxide in your body, it is not going to release enough oxygen into the blood,
oxygen.
okay, and it's not going to reach
Correct.
your organs. So what you actually measure by a pulse oximeter and say, no, no, my oxygen is good, but that is the external flowing oxygen. It is not the level of oxygen which is reaching your organs. And
That's true.
interestingly, even when people say that, no, I sleep for 10 hours, I'm pretty healthy in sleeping, I sleep like I'm a very deep sleeper. But you don't realize that, are you really falling into deep sleep or not? These kind of
Correct.
people are generally, not a morning person, like slept for 10 hours, still not feeling fresh in the morning. They feel
Yeah,
fatigued. You can also ask your patients about that. They constantly feel tired through the day. They feel
tired.
very fatigued that, I just don't feel fresh and I don't realize where my pain is coming from. These are the kind of people generally have, sleep and airway issues.
Yeah, yeah. So I think patients who complain of chronic problems, constantly feeling exhausted, constantly in pain somewhere or the other, recovering and then relapsing again,
Right.
and relapsing no matter what, whether they're exercising, not exercising. So I think these are the patients to look out for in the general population. And also obviously snorers and mouth breathers, and to see how their bony structure is,
Right.
right? So that is one thing where physiotherapists can really integrate with the dentist and do a collaborative thing where actually the patient is at the center of everything and is benefiting from this collaboration,
Yeah. Yeah.
right? So we have a nice session by Dr. Sarosh, right? Jagi, Dr.
Right.
Jagi. And so all the physios watching this, please take advantage of this opportunity where he is going to speak to us personally via Zoom, right, Ankita?
Right. And there's also an interesting physiotherapist in the session, Dr. Cynthia. So I think it will
Yeah,
be great for physiotherapists to be attending it, because you guys will understand more on a physiotherapist note what you guys, where you all play an
yeah,
important role over here,
yeah.
you know. And
And
that's
yeah,
on
sorry, I'll just
21st of this month. So I believe that's your Wednesday, I think.
yeah. So, guys, feel free to reach out to us for the links to register. And also, if you all have any questions, please put them down in the message box, like add a comment.
Definitely.
So,
And you know,
Ankit,
Himani, when we're talking about this, let's talk or chat a little about the fascial system also. As
yeah,
we spoke a
yeah,
little about, how the whole tongue is integrated into the fascial system. It's so interesting that when we take scans of patient before the release and after the release, we see the airway and the spine straightening up within like 20 minutes of the release. This whole
yeah,
thing.
yeah,
So I'm so astonished, how that fascial system plays such an important role. And I
yeah,
saw such an
yeah,
interesting video where, they had made the person wear like a little Spider-Man coat, very tight
yeah,
coat, and then
yeah,
they
yeah,
tried to pull that patient from one side, and how the whole body compensated. It's not like you won't be
correct.
functioning, but the compensations play such an important role that you land
Yeah.
up with long-term problems every time.
Yeah, so basically, when it comes to fascia, a lot of people think, oh, it's just the connective tissue, right? And mind you, it's not just the connective tissue. It's a dense network of so many kind of different receptors. Fascia is literally everywhere. It's around the nerves, it's inside the muscles, it's outside the muscles, it's enveloping the muscles and ligaments and everything. In fact, fascia, strands of fascia which become tight or which become strong and rigid over time, they form into ligaments eventually. So basically, the fascial system is the one that dominates the force transmission in the entire body. So it's like a block of which is a game Zenga, right? So if one block is out, you know that that's the weak link, and you're very careful to remove that Zenga block out because you know that if there's something that goes wrong, the entire structure will collapse. And that is true for our body also in a certain sense. So if connective tissue at one area is tight, pulled, it is definitely going to pull all the it's going to pull the entire body towards that area. So when we are evaluating, we see a lot of people standing with right dominant, right? A lot of people putting more weight on the toes versus the heels. A lot of people standing crooked. Eventually, fascial tightness at one area can also cause scoliosis or kyphosis or lordosis, like extreme spinal structures, like over time, as the force transmission keeps on getting affected. Now, how do you stop this, right? One way, obviously, is to figure out where the problem is coming from, where there's fascial tightness, and start treating it. Now, a lot of times you find that, okay, previous shoulder injury or previous knee injury has led to the fascia becoming tight over there, and the person doesn't have enough mobility or stability in that area. You start correcting that. But we sometimes forget to include the entire kinetic chain. Once you start including the entire kinetic chain, you forget this area because you're not used to working on this so much. And you will realize that after you've worked on the entire kinetic chain, the jaw position is still the way it is. So a lot of people will have like jaws that are tilted like to one side, or jaws when they open unevenly in each side. Then they have TMJ, clicking, locking. Then they will have no signs and symptoms but only complain of headaches on one side, only complain of jaw pain on one side. And that's easily treated by giving medications or just saying, oh, visit your dentist or visit probably a head doctor or something like that. Visit your primary physician and figure out why you are having headaches.
True.
But it's important to look at the muscles over here, which are the masseter muscles, the temporalis, and figure out which, if they have become tight. Because eventually, those muscles are also a part of the entire body fascial system, which we forget to really address, right? Most you will not see physios checking this. It's a temporalis type. You will not see physios checking the masseter unless they have an actual TMJ problem. So I would actually like to encourage all of y'all to start checking those muscles and then see if they are really tight or not. And I'm
Right.
sure you will figure out, you will find for yourself differences from person to person. It's a learning experience. Even I'm still learning. And once you start releasing, you will see those areas give you more benefit.
Right.
And
I
it's just not the head part of it.
right.
A lot of people also forget to look at the feet because feet is the point of contact to the ground. And I feel that the way we are applying pressure or the way we are standing is extremely important because it will dictate the way our body is going to function top down, down top.
True.
Correct?
True.
So, what do
Very
you
well.
think about this?
So I just feel that whatever you said makes so much sense here, and it's so important that we increase our observation skills and history taking. Listen very carefully what the patient has to say. So the more we listen, the more we take the history, the more questioning that we do, and the more we observe, I think we are going to change the way we actually look at that problem, and we can come to the root cause and have a more sustainable treatment rather than having, repetition of episodes then.
Yeah, that's so correct. So, let's kind of consolidate whatever we've spoken up until now.
Yeah.
So, for the physios, very important to look at your head position and to check for stiffness in the trapezius. A lot of us do check for stiffness in the trapezius, but SCM, masseter, temporalis are three other muscles that you all can look at along with it. Um, check for upper cervical extension or flexion. And if in spite of repetitive efforts, if you find that the patient is relapsing, in spite of doing proper exercises and proper treatment, think about some involvement of the jaw and the breathing. Um, Also, when you're thinking of integrating all of this, look at the entire body as a whole, from the toes to all the way up to the head, because the fascia right on the cranial bones also plays an important role. Do not forget to, again, I'm re-emphasizing this, look at the breathing pattern, whether the person is mouth breathing or nose breathing, and tell them, make your patients aware because this is very important. They themselves will tell you. At first, they will definitely deny, but eventually they'll come to a point where they'll be like, yes, maybe I do mouth breathe, right? So I think in this situation, it will be a win-win for everybody. And if there is any need for further evaluation and you feel lost at any point, feel free to contact me for the physiotherapy part of it and feel free to contact Dr. Ankita for the dental part of it. And we would be more than happy to assist you with any form of questions, links, study material, uh, research articles, whatever you all need. And also, do
Right.
not forget to register for the upcoming session. It's going to be extremely informative. I've also registered.
Yeah, and actually, there is so much that we have the entire collab where we are going to be having sessions through the entire year, and we're going to discuss
Correct.
different aspects of the area. So if you all are really interested, if this resonates with you all, you can join it so that you can have an access to so many case presentations, different doctors sharing their viewpoints. We have international speakers, we have Indian doctors. We're going to
Yeah.
do case presentations. Patients are going to come and share their experiences. We also have a lot of research paper discussions. So there's lots to learn, and I think learning shouldn't end for anyone. So I encourage all you doctors. Let's learn. Let's bring about this change in the way we approach our patients. I think we're just going to bring about a new way of medicine today.
Absolutely. I think integrative healthcare is the way to go forward. And
Totally,
also,
totally.
actually, I was thinking about something which I just thought about and it went out of my mind. Ah, oh God. Okay, Ankita, I'll let you take over till that thought comes back to me so I can share it. It was a really
No, I'm
okay,
very
yeah.
happy. Yeah.
It came back to me. So this kind of airway collab, I mean, sorry, it's very funny. It happens quite a bit. So this kind of airway collab is not only important for orthopedic physiotherapists or musculoskeletal physiotherapists, but also extremely important for people who treat sporting population and people who treat cardiopulmonary patients because this will give them a better idea of how to integrate everything. And after learning all of this, they'll be able to apply the concepts that they already know with a better understanding. So,
Correct. And I
cardiopulmonary,
think even it's
anybody who is
important for
treating,
those who are with infants, those who are working with infants and children,
correct, correct.
it's going to be helpful
Yeah.
for these also. Yeah.
Yeah, so basically, this is a concept which is pretty common to like pediatric physiotherapists, musculoskeletal orthopedic physiotherapists, sports physiotherapists, and even the geriatric population. Because I feel it's applicable to everybody seriously because breathing never stops at any age until obviously you die. So you want to breathe correctly and you want to advise your patients to breathe correctly. And in case if they are not, then you want to guide them to appropriate channels which can help them out.
True. True.
Uh,
So I think
so
we should
I'm
call
actually
it.
going to discuss. Sorry, I was thinking of discussing another case. Is that okay
Tell
with you,
me.
Dr.
Yeah,
Ankita?
please. Yes,
So
please
basically,
say which one.
do you do you remember this patient who had come to me, a young child, like she was I think 24 years old, correct?
Yeah. Yeah. I
And
agree.
she had undergone multiple surgeries throughout 4 years because she had constant tailbone pain. And her tailbone pain would just not go away. She had gotten her coccyx out, taken multiple corticosteroid injections, and done n number of procedures, developed infections in that area, and eventually she came to me seeking for some kind of remedy. And for the first 10, 15 sessions, we were just concentrating on her lower back, her neck position. And slowly and steadily, I got to asking her about her jaw pain and her headaches. And surprisingly, or not surprisingly, I realized that she definitely had something in her jaw because she was in constant pain. Whichever area I touched was painful for her. And it was not just the jaw, it was obviously jaw, the lower back, and certain areas of her cervical spine. Everywhere else, her pain scale was around 3, 4, but as soon as you get closer to the jaw or you get closer to the pelvic bone, it would jump to 8, 9, sometimes 10, and sometimes her screaming. Right? So eventually I realized that such patients, and Dr. Ankita also met that patient eventually, such patients, like she was someone who was in so much pain and she had so much anxiety that after a certain point, she just learned to live with that pain, right? And there are certain research. Oh, sorry, I just kicked the stand.
No problem.
So you realize that such patients who are being constantly in pain, who have chronic pain, they are highly sensitized with respect to their pain tolerance decreasing. They have decreased tolerance even with respect to the muscles. So they can't do the daily things that we all can do. They are in constant pain. And such kind of patients are extremely uh, susceptible to getting into that cycle of pain, not being able to do anything. Because they're not able to move, they again have more pain. And the cycle goes on and on and on. And it's really important for us as physiotherapists and dentists to realize where to break the cycle and how to break the cycle for them. Correct?
Because Himani, these people go into a fight or flight response. If you've heard of it, the
Yeah.
sympathetic drive
Yeah.
gets activated, and that
Yeah.
happens because of an irregular breathing and sleep. And if they're into that fight or flight response, they are going to be always anxious. They are going to be, and most of these patients I've seen them because they're so used to dealing with it and they don't know where they're coming from, and most of them describe it as like psychosomatic pain, and we just
Yeah.
feel like, oh, people call me psychosomatic. That's not really the
Yeah.
case. Like
Yeah.
it's us who really need to dig in,
Yeah.
like why are they having this pain? A
Yeah.
patient will never
Yeah.
come to you saying that, okay, I keep on having pain. We really have something, that's when they're telling you. So we as
Yeah.
doctors really need to just get to the root of it. Why? Figure out that why
Yeah.
always has to be so important for doctors, that we should be finding out why is this happening? Why is this happening? And that's where we lead to
Yeah.
a progress in treating cases.
Yeah. So this is one thing that I really wanted to put out there because this was a brilliant example of an extremely chronic pain for a patient this young, and for a patient at her point, she would want to do so many different things. And instead of doing so many other different things, she is down with pain, not being able to do, not being able to go out and lead a normal life. So I feel to identify such patients and to take care of them is our duty, and we should be equipped with all the necessary information to be able to do that. Correct?
True.
So,
True. So agree.
if you all have any questions or Dr. Ankita wants to say anything,
Yeah, I'm. If there are any questions, we can answer them, or we can call it, and they can even. I'm sure we'll be saving the live, so they can even post their questions later. Also, we will be
yeah.
either of the two will be very happy to address it.
Yeah, correct. So I think we'll just call it a day because we don't have any questions as yet. And
Right.
if you all need anything at all, please feel free to contact Dr. Ankita or me. We are always available. And all right, have a very good day. Thank you,
You
Dr.
too.
Ankita,
Have a
for
good
joining
Sunday.
us.
Bye.
Bye. Take care.
See you.
See ya.